When you suddenly stand up in the morning and feel like your legs aren't really yours, everything around you seems a bit unstable, and your head feels light, you might wonder, is this something serious, this dizziness or spinning sensation? With this one word, we describe many different feelings, but not all dizziness is the same thing. Today, in very simple language and in a story-like way, we will understand what dizziness really is, why it happens, and when it is important to see a doctor. This script was written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. The information has been taken from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, let me remind you not to forget to subscribe to the channel to get more of these easy, science-based, doctor-reviewed educational videos. What is dizziness or feeling lightheaded? Dizziness or feeling lightheaded doesn't just mean your head is spinning. Doctors usually divide it into three categories. The first is vertigo. In this, it feels like either you are spinning or the room itself is spinning. This usually happens due to problems inside the ear. The second is lightheadedness. In this, it feels like you might faint at any moment. Your head feels empty and your vision goes dark. The third type is loss of balance. Here, you don't feel like you're spinning or about to faint, but when you try to walk, it feels like you might fall. Sometimes, you may experience a mix of these three sensations. So, while saying dizzy or feeling lightheaded sounds simple, understanding the actual cause is difficult. Why does dizziness or vertigo occur? The reason depends entirely on what type of dizziness you are experiencing. For example, feeling lightheaded or faint, let's say Reena gets up suddenly from bed in the morning and stands up. Suddenly her head feels light. This could be due to orthostatic hypotension, which means a sudden drop in blood pressure when standing up. There can be other reasons as well. Dehydration, being in extreme heat, not eating for a long time, low blood sugar, anemia, irregular heartbeat, anxiety or panic attacks, side effects of certain medications. These can all cause dizziness. The sensation of spinning or vertigo is usually caused by these factors. It originates from the inner ear. The most common cause is benign paroxysmal positional vertigo, or BPPV, where turning over in bed triggers the spinning sensation. Other possible causes include ear infections, migraines, Meniere's disease, and in very rare cases, stroke. Loss of balance or feeling unsteady can also be reasons. This is seen more frequently. As people age, problems inside the ear can be a cause. Head injuries, nerve disorders, stroke or brain issues, and sleeping pills or alcohol can also lead to dizziness. What should you consider if you feel dizzy? Most of the time, dizziness is not dangerous. However, if certain symptoms are present, you should not delay seeking help. For example, if you suddenly hear a noise in one ear or experience hearing loss, blurred vision, sudden slurred speech, weakness in your arms or legs, chest pain, or loss of consciousness, if any of these occur, go to a doctor immediately. When should you see a doctor? If dizziness happens repeatedly, lasts for a long time, or you cannot understand the cause. Or if you have other unusual symptoms along with it. If you lose consciousness during exercise, that is an emergency. What tests are done? The doctor will first listen to your symptoms, then examine you, checking your blood pressure, pulse, eyes and ears, walking and balance. If necessary, blood tests, ECG, MRI, or CT scan may be done. Hearing tests may be done. The treatment for dizziness or vertigo depends entirely on the underlying cause. Ear infections often resolve on their own. If it's BPPV, special head movements can help. If it's a heart problem, medication or a device may be needed. If it's caused by medication, changing the medicine usually solves the problem. If anxiety is the cause, therapy and medication can help. Sometimes, medicine is given just to reduce the symptoms. Can dizziness or vertigo be prevented? Not all dizziness can be prevented. However, some simple steps can help, such as drinking enough water, eating on time, not standing up suddenly, and reducing alcohol consumption. How do we maintain our balance? Our balance depends on three things: the eyes, the nerves and muscles, and the inner ear's balance system. If there is a problem with any one of these three, dizziness can occur. The main point is that dizziness itself is not a disease. It is a signal from the body. Most of the time, there is nothing to be afraid of. But it is very important to listen to your body. If you have any doubts, consult a doctor. If you find out in time, solving the problem becomes easier. This script was written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. Information has been taken from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. If you found this video helpful, please subscribe and share, because awareness is the first step to good health.